We have the Twitter feed open. I wonder.
Yeah, thanks for all your tweets. They're actually really awesome. Social proof seem to be blowing up. Got a few mentions. But I think one of the questions, and I hope it's okay to ask, is what happens when an organization does something controversial? Komen is an example. Recently, also the Kony stuff in Uganda. What happens when a community does something controversial? How does that impact the community? How does that impact fundraising? How does that impact how you build community? So I hope I'm summarizing. There are a lot of questions on that, so I hope I'm summarizing okay out there. I don't know.
Our chairman has never done anything controversial before, so we don't really have
I'm not looking at anyone in particular. Yeah.
No, I think we've worked really hard over the years to. Lance is obviously a very public figure in the face of our organization, and having been there 8 years, I'm very well aware of how committed to the fight against cancer he is. But he's obviously had some public beatings in the media, and people sort of have their opinion of him one way or the other. But I think over the years we've really tried to sort of separate ourselves from him as an athlete versus our mission and what we're here to do. And so we haven't had to deal with it too much. Fortunately, it didn't affect fundraising when he's had various issues go on in his life. So
I mean, it seemed like, from my just reading, it seemed like the Komen was in the news a lot lately, and that actually drove more donations than normal. So I mean, I guess does the controversy?
We gave Komen $100,000 after that controversy because we're very committed to sort of breast cancer screenings for women, and part of the money that Planned Parenthood was going to lose was going to make it basically women wouldn't be able to get screened. So we felt very passionate about that. Our board moved really quickly to decide that they wanted to make that gift, and so it does. I mean, being in the, whether you're good, bad, or indifferent, it definitely affects donations.
I think, I was just kind of thinking out loud here, but that's an interesting aspect of, for better or worse, Planned Parenthood kind of being the enemy or the opposition. And I think, one thing, and we don't do this, we're probably the least controversial organization of all time, we just don't even have time for it. But what I do see being really effective on our networks is that people make the disease or the condition the enemy, and it's not it's not always healthy. That can become negative. It can kind of encapsulate you. But to a certain degree, I think it does help some of the patients rally together because they can all talk about how this cancer or this aneurysm or whatever it is they're suffering from, how it's taken something away from them, and how the really good ones, the really good moderators and leaders on our communities spin that into a positive and remind the rest of the patient group that they're living life still and they're still contributing and they're helping each other. And so, having something to rally against can be helpful.
Yeah, one thing about being a community manager is really just knowing when and where and how to use your role. And sometimes it's sitting back and being patient, and if there's negative comments or things going on, sometimes you'll see people in your community come to your defense, and it's not always to your advantage to be the first person to always be responding, because then people feel like there's some big brother always watching over you. So sometimes there will be people that will come to your defense, but in the bigger circumstances, it's probably important to think about taking a stance and how you can use it to your advantage.
And since Twitter's moderating for this question, I'll feel free to answer, because I think sometimes it's the kind of controversy, and I don't think you should be afraid to embrace controversy when it's in advancement of your mission. And as a group that tries to help people not to start smoking or quit smoking, sometimes we pick fights, and we pick fights with the people in the industry who are trying to get kids to smoke and try to keep people hooked. That's the kind of controversy we're willing to embrace, the kind of controversy that emphasizes your mission, not the kind of controversy that overshadows your mission.